Greetings, colleagues. Wonderful to be with you. I wish I was in Korea with you, but unfortunately unable to join you. But it has been a while since I've been with my hero friends, and I really look forward to meeting you again soon. Um, I'm really looking forward to having this opportunity to share some thinking on multi-level country planning, particularly the WHO Quality Toolkit, and some thoughts on global learning. Earlier during the symposium, you heard from Dr. Rudy Eggers, our Director of Integrated Health Services, on monitoring health systems through a primary healthcare lens, and particularly data use for health service performance and quality improvement. And I'll be building on that primary healthcare approach and operational framework, and particularly the measurement framework and indicators that he outlined in his presentation. And of course, many of you will be aware that equity, quality, and resilience are cross-cutting features within the primary healthcare measurement and evaluation framework. And with some considerations clearly for action and corresponding indicators to guide quality of care improvement. So my intervention today will really focus in on these concepts, but thinking through what we can do related to quality of care. Now, this is not any news to you, but when we're working across the world, particularly in settings that are difficult, we are always bringing attention and very clear attention to quality of care as having a dramatic impact at scale for saving lives. And it's an important point to highlight because in Korea, of course, you are very well advanced in your journey on quality of care. You know the importance, but in various parts of the world, we have to make the case. And that's an important joint responsibility that we have. Let's just remind ourselves of the primary healthcare approach and the three interdependent aspects of the primary healthcare approach: the primary care and public health functions, the empowered people and communities, the multi-sectoral policy and action. And really thinking this through, and again, you will be familiar with this, the interdependent primary healthcare levers, the strategic levers and the operational levers, give us an opportunity to ensure that our efforts on systems for improving the quality of care are not seen as a silo, but that are seen as integral and parts of health system strengthening and the entire primary healthcare approach. And that's what I'll be delving into. This lever on systems for improving the quality of care really emphasizes local, subnational, and national level efforts to work continuously on improving the quality of services. And with that in mind, I'm going to give you a bit of an overview of a key resource from WHO related to multi-level country planning. Some background on this key resource: it was developed based on country requests for support on practical actions, and importantly, was informed by implementation experiences, particularly in the African region and also countries in South Asia. This was an effort that was taken forward by a subgroup of WHO technical experts within WHO headquarters. And importantly, the emphasis was on co-development, ground truthing, and parameters that were defined at the onset: practicality, short, and focused. So what is the purpose of this resource? This planning guide focuses on actions required at these three levels, and again, to emphasize, highlights a health systems approach and is relevant to staff working at all levels of the health system. The reason I share this with you today is in recognition that Korea has a huge responsibility, if I may say, to support countries that are traversing this journey on quality of care. There's a huge opportunity for joint learning and cross-learning across countries. And importantly, this planning guide is a supportive, non-prescriptive resource. Let's take a look at what this entails. Foundational requirements for quality health services, and at the same time, thinking through guiding principles. Now, each of these foundational requirements for quality health services that you see on the left side of your screen are not any rocket science news to any of you. On-site support, measurement, sharing and learning, the engagement aspect, and ensuring a strong emphasis on management. And guiding principles, again, will not be news to you all. Starting fast, building on existing structures and functions, supporting health workers as a priority, improving care for people, and adapting to context. And this last guiding principle particularly is critical when we're working with some of the most challenging environments across the world. Let's take a look at each of those levels. At the national level, and we were just hearing Luke mentioning that the fact of setting strategic direction is really key. One of the things that was emphasized within the WHO, World Bank, OECD publication that Shin mentioned is a real emphasis on ensuring national level strategic direction setting on quality of care through the development of national quality policies and or strategies. And this needs to take a holistic approach to all of the domains of quality, such as patient safety, such as effectiveness, such as people-centeredness, but also a strong emphasis on timeliness, equity, efficiency, and integration. So at the national level, these efforts really need to focus in on national strategic direction setting, but ensuring that there is a pragmatic, and I emphasize that word, quality measurement framework. Again, Korea is highly advanced in this aspect, but when we're working with countries in different contexts, we need to be pragmatic, and this quality planning services guide gives us that opportunity to do so. District level. Often we forget the importance of the subnational level. The guide really emphasizes these points in a very clear way, and the facility level quality improvement efforts are of course critical, and that's where the rubber meets the road. Should emphasize that community engagement is embedded within these three levels of work. Let's remind ourselves again that the PHC operational framework highlights systems for improving quality of care as one of the interdependent levers. This guidance gives us the opportunity to take that to the countries and instill change for positive health impact for populations. Taking it a little bit further, recently WHO has released the WHO Quality Toolkit. We were delighted that our Director General joined us for the launch of this Quality Toolkit, literally just a few weeks old now. What does that do? It helps us to move beyond the national, subnational, and facility level effort to think through key tools that will help us in our journey. So drilling deeper, and the ultimate goal is summarized through this acronym of IMPROVE. Identifying tools and resources, mapping, planning, recognizing, optimizing, and visualizing and engaging. So this is the essence of our WHO Quality Toolkit. Who is it for? Again, no surprises. It's for those that are really responsible for leading change at all of these levels. What's in the Quality Toolkit? For the first time, WHO has brought together all of the WHO technical resources focusing in on quality of care within a web-based environment. And if you want further information, there is a recording of an orientation webinar focusing in on this. But you can see that the key functions for supporting quality of care, whether it be national strategic direction setting, standards supporting quality, oversight and regulation, measurement and evaluation, management, operational and supervision support, improvement interventions, and engagement. And it's categorized by these levels that I was mentioning earlier on: national, subnational, facility, and community. Importantly, we envisage that this will be updated regularly, and I would encourage colleagues to do take a look, and we are dependent on feedback to make sure that we are improving on this process. This gives you a snapshot of the different types of resources and tools that you see. These are all WHO resources coming in from different parts of the house. As would be expected, a large contribution from the patient safety side, but also a large contribution from our reproductive, maternal, newborn, child, and adolescent health colleagues. All of these tools come together holistically for action at the country level. One further point of emphasis that this toolkit also focuses in on is ensuring that the end user can either go right to the search and identify those tools, but also for those that are not familiar with health systems, to give colleagues a real orientation on how quality of care issues are embedded within the levels of health systems. And that allows particularly those that are at the start or early in their implementation journey on quality of care to understand core concepts, and then also to see what functions are really critical and the tools that can support those functions. Just to give you just a quick overview of the main landing page here is that those that are new to areas of health systems quality or want a refresher can go down a pathway. Those that want to learn a bit more about the toolkit itself can go down a particular pathway. And those that are very clear that they need a specific tool can go down a specific pathway, focusing in on a clear search function. It's important to just re-emphasize, and the point of emphasis here is that there is the Quality Health Services Planning Guide to give us clear articulation of the different actions required at multiple levels, and the Quality Toolkit that takes us further into the weeds and the messy realities of improving quality health services. Let's now turn to the third part of this conversation related to learning. And it's critical, as we all know, to ensure an effective learning mechanism to capture the wisdom from the front line. The Quality Toolkit emphasizes this critical learning issue, and as you can see listed on the right, the number of learning collaborations that are hosted by WHO. I'm going to focus in on two such learning endeavors. The first, and this is something that I know some of you have probably been familiar with and have actually engaged with, is the Global Learning Laboratory for Quality UHC. Now, when this was established a few years back, the intention was to create a safe space to share knowledge, experience, and ideas, challenge those ideas, and spark innovation for quality in the context of universal health coverage. Many of those priorities have been taken forward, particularly, and on the right side, you see a particular focus on national quality policy and strategy. It's a really important cross-learning that occurs between countries. The Global Learning Laboratory has a repository of existing national strategies from across the world, and importantly, allows those that are shaping these national strategic directions to exchange with each other. there is a focus on the second arm of the Global Learning Laboratory on technical areas and interfaces between quality of care and particular technical areas such as IPC WASH or HIV quality of care. And the third, and I believe a critical aspect of our learning, is the focus on compassion, ensuring that we focus and learn about the intersection of compassion and quality health service delivery within the context of UHC. Now, compassion can often be considered a softer science, but it is a critical one from all of the discussions and the learning that we have been involved in. It is clear that compassion, an awareness of suffering, an empathy related to that suffering, and action to respond to that suffering is critical in our efforts in quality of care, particularly in the COVID-19 context. Just moving into the vast amounts of information that is out there from across the world, we have just touched just a very few parts of that vast knowledge pool that exists across the world. But what I would say is that it at least highlights some of the actions that have been taken across the world and ensuring that those are captured and that they don't fly away in the wind. One of those pieces that would be very important for me to emphasize is issues such as in electronic client feedback systems for HIV programs. Now, this is where the connectivity, again, with those different interdependent levers come in. Digital health, how does it interface with quality of care for a specific disease program? So those experiences from the country level can give us insights which we will never be able to find from the work that we do at the global level. There are other examples of health quality and the quality of care moving forward and ensuring that the essential health services during the COVID-19 pandemic, for example, in Ethiopia, thinking through how the role of emergency operating centers is taken forward. So these examples exist, and it's an opportunity to ensure that there is cross-learning in everything that we do. I mentioned COVID-19. Another very important learning area is how we have been able or been unable to maintain and strengthen essential health services during the pandemic. And this is where the COVID-19 Health Services Learning Hub comes in. And I would encourage you to take a good look because, again, don't want to go into the details here, a vast array of action briefs, learning briefs in various subject areas from across the world. And again, we don't want the pain and suffering that we have encountered through COVID and to be the learning to be thrown away. We need to look at this very clearly. When I look back at the West Africa Ebola crisis, we said many things during that time. And particularly in the recovery phase, we were emphasizing the critical importance of quality and safety. But unfortunately, we were unable as a global community to take that forward. So the key takeaways from this conversation that I'd like to highlight, and I know that you'll all agree, action on quality of care, of course, is an urgent priority for all health systems globally. And so it's a joint responsibility. I want to emphasize that there is a very clear and key resource in the Quality Health Services Planning Guide and the Quality Toolkit as a package to help plan and take action, and ensuring that we can move on this with a health systems approach. And there are clear mechanisms in place to facilitate cross-country learning. We need to use this and share collectively. I'd like to end with something that our Director General had emphasized back in 2018. If there's nothing that we take away from this conversation, I'd like to highlight these 5 words. Quality is not a given. So it's our collective responsibility to make sure that those words ring true at the country level. And it does take vision, it takes planning, investment, compassion, and meticulous execution and rigorous monitoring from the national level to the smallest, remotest clinic. Thank you so much for this opportunity. It's a real pleasure to be with you. And again, I really do hope that in the future, we'll have this opportunity in person. Thank you.